So moving on to PrEP and COVID-19. So can people still access PrEP during the COVID-19 pandemic?
So yeah, so PrEP, so pre-exposure prophylaxis for HIV. So the people who have already been prescribed that and who are on PrEP, they should be able to access that as not as they were before, but they will continue to get their prescriptions. They will probably be contacted by the sexual health clinic, and most of the clinics are still doing blood tests for HIV and syphilis, giving you your medication and organising to see you in the next 3 months. So the people who are already on it, they should be able to carry on with it. The difficulty or the problem is more people who are not already on PrEP. It's a little bit harder to start just now. But if people are at really high risk, what you'll probably find is that at the clinic's discretion, they will see them and see if they need to start, they'll start. But yeah, you can definitely access it just now. It's just, again, done by telephone rather than the face-to-face appointment.
And some of the guys online have asked us around self-sourcing PrEP at this time. So do you think that's an option for them? There seems to be no...
Yeah, absolutely. I mean, it's always been an option to access PrEP. Advice is obviously just now is to try and minimise the number of partners possible because of physical distancing, but in some situations that's not possible or is not what people are doing. So if they need PrEP, again, a phone call to the clinic, somebody will assess whether you need it and can see whether you need to, maybe they'll bring you into the clinic or maybe they'll give you advice about what to do about self-sourcing it.
Okay.
Again, a lot of people were on daily PrEP before COVID, and in some situations they might be able to move on to event-based PrEP, so not taking quite as many medications if they're not having quite as much sex. But that's really only suitable for, I guess, cis men. So again, it's just a conversation with the clinic, although there's lots of information on websites like HIV Scotland's website as well about that.
And some guys have asked us if it's okay just to stop taking PrEP during this time because they're not meeting other guys for sex at the moment.
So yeah, absolutely. But again, there's just some caveats around that in terms of how long you need to be on it after your last sex. So in the case of cis men, it's 2 days, but anybody else, they have to be on it for 7 days after that. And again, if you need to restart it, you just need to be careful how you restart it. You'll need 7 days if you're anything apart from a cis man. Other people would need double dose 2 to 24 hours before their first sex. So it's just having that all clear in your mind. If you're used to taking it every day, there's just a couple of things you need to take into consideration.
Moving on to sex and COVID-19, so can you transmit the coronavirus through sex?
So I guess it depends on what kind of sex you're having. So so COVID-19 is primarily, as we're aware, transmitted by droplet spread, and so obviously when you're having sex with somebody, you usually less than 2 meters away from them, so you're going to be in close contact with them, so you're likely to be in contact with any droplets coming from the mouth or the nose. They've also found COVID-19 in faeces or poo. So in some situations where there's maybe rimming or anal sex, perhaps that might be a source of infection as well. I know that again they're doing studies and looking on COVID-19 in semen and things like that, but again it's quite hard to understand that all yet because it's hard to know whether the virus that they're finding is actually infectious or whether it's just there. The advice would be to minimise your risk of COVID-19 and to minimise your partners.
Mm-hmm.